That should be cute.
Thank you for joining us for this conversation. My name is Katie Hallett. I'm the convener for the League of Women Voters Salem. The League of Women Voters is a political advocacy organization, a grassroots organization, with the mission of empowering voters and defending democracy. And the way we do a lot of that work locally is we host educational events such as this. So thank you for joining us. Tonight we're here to have a conversation with each other and to envision a world, or at least in Massachusetts, where everyone has real access to affordable health care. How would that be different for us? What would that feel like? There's pending legislation at the State House, as there has been every year since 2011, to create a statewide single-payer health insurance system for all people in Massachusetts, known as Medicare for All Massachusetts. The League of Women Voters of Massachusetts has endorsed this legislation, but tonight's conversation is not going to be about the nitty-gritty of the bill, although in a moment we'll hear from Representative Cruz, one of the co-sponsors, about why this bill and this issue are important to him. If there's ever going to be such a huge change to the status quo, there'll have to be a groundswell of grassroots support. So we want to start a conversation with all of you here tonight about your experiences with healthcare access and your vision for the future. Are you satisfied with the way things are already? Do you want something different for the future? If it could be established, does universal health care for Massachusetts people sound attractive to you? Some of the planners for tonight's conversations are from the League of Women Voters Salem, specifically our healthcare reform working group. Bob Mason is a local volunteer with MassCare, the Massachusetts Campaign for Single-Payer Healthcare. Our interpreter was kindly provided through the North Shore Democratic Socialists after Lindsay Schussler joined tonight's planning committee and connected us to the DSA. So we're going to record and edit tonight's discussion, and we'll send you a link to preview. We're so happy you're here. You don't have to talk if you don't want to, but we would love it if you did. The League and MassCare will likely host a big educational forum that will delve into the Massachusetts Medicare for All legislation, where we hope we'll get into the details of what's proposed. Hopefully that forum will happen in early 2026. We'd like to invite as speakers the primary sponsors of the bill, including Representative Sabadosa and our local officials, such as Representative Cruz and Senator Lovely, who are co-sponsors. We'll plan to use tonight's recording and clips from it to generate excitement about the next forum and additional events. We'd like to spark discussion and interest in healthcare and health insurance reform. With that, Representative, getting ahead of yourself, Representative Manny Cruz will introduce himself.
Well, thank you so much, and it's such an honor to be here today to be able to talk about a really important policy. And so just a little bit about me. My name is Manny Cruz, and I proudly serve as the state representative for the great city of Salem. I'm also in my last month of service as the vice chair of the Salem School Committee, and my life has been about giving back. I grew up right here in this beloved community of mine, going to the Boys and Girls Club, through our public schools, and I get to see the vibrancy of our community every single day as we debate the issues, we build coalitions, and Salem is truly a really special place to live. And as I think about what brings me into this space as a legislator, I always talk about the why. It is the most central thing. So if I could tell a little bit about my story, I grew up in a household in which I was raised by a single mom who survived domestic violence and had to take me and my three brothers under the cover of night to escape. And my mom was really fortunate that she got connected in a country where she didn't know the language to social workers who helped ensure that we had all that we needed to be able to survive as a family. So filling out our applications for Section 8 housing, ensuring that my mother was getting things like SNAP, food assistance, but then also helping my mom apply for health insurance for us, and making sure that we could enroll in things and programs like Mass Health. And as I think about myself as a legislator and my own story of self, having Mass Health throughout my youth when I was growing up transient, living in an immigrant household, I think it was really critical because it ensured that myself and my brothers, we had a healthy start. And then as I grew older, I'll never forget my first experience with learning about the gaps in coverage. Actually came at a time in which I got appointed to Governor Patrick's statewide youth council, and friends of this particular campaign in Healthcare for All reached out to me because I was a Mass Health recipient, and we were advocating for legislation around the gaps that exist for Mass Health recipients when they transition, and trying to mirror some of the provisions that were in the Affordable Care Act. But one of the things that I know to be, really true about my own story is that when I did have a gap in coverage, when I attended college, it came at a really difficult time in which I was a young man attending Northeastern University. I was struggling with my mental health, and I had a breakdown that led to a hospitalization. And I'll never forget going through this traumatic process with my then fiance. And then at the end of my experience, getting the help that I needed, I received a medical bill. And that bill was in the tens of thousands of dollars. And I remember how that compounded on my anxiety that I was experiencing at the time. And to make matters worse, within just a couple of weeks, I was readmitted to the hospital and received another bill. So this issue of medical debt that comes from our healthcare system and the catastrophes that everyday Americans and our Commonwealth experience is something that's near and dear to me, because I've had the lived experience of having to deal with crushing medical debt. So in my own personal experience, of having had coverage under Mass Health, then dealing with medical debt, getting to a place where, I feel like I have some financial liberty, I think that from my own lived experience, I recognize how important this is. My second story I'll tell is, when I first came to the legislature, I did so as a legislative aide for a state representative, and I'll never forget my mentor telling me her story of why immediately upon joining the legislature she became a co-sponsor of this bill, and it's probably a large reason why it didn't take me very long coming into the session to say that I was going to sign my name onto this bill. It was a top priority for me, and it was because of Juana's dad. My former boss, her father, got cancer at the end of his life. And it was considered terminal, the diagnosis, but he was a small business owner who had provided so much for his family, started a bodega in Lawrence, and he had paved the way for his 4 children to go to higher ed, to do all the things that are part of the American dream. And when he got the shocking diagnosis that he had cancer, as a small business owner, he was already paying out of pocket for his health insurance through the ACA exchange. And then what ended up happening was he had to make this harrowing decision to give up on his dream of continuing a small business, leaving something behind for his children, and then ultimately, giving up his employment so that he could qualify for Mass Health in order to get the care that he needed. So he was one of the very lucky people that was able to enroll and to continue with his life and to have, I think, a longer life than he would have. But every person should have been afforded that opportunity is the argument that Juana made to me. So if I wasn't a believer based off my own lived experience, my mentor actually bringing this larger concept that there are so many other people that find themselves in the situation that need this option certainly solidified it. And if I think about my journey in the 3 stages of where I was as a young person, where I was as a young professional, and now as a legislator, I host regular office hours at the Senior Center, and I think about my constituents, the stories that I hear from so many of our residents who are dealing with this affordability crisis in healthcare and the challenges that they experience with staying healthy, how that impacts them financially, and how much better off so many of them would be if they did have coverage that didn't require them to pay co-pays when they were on their visits. I think about one constituent in particular. I won't use her name, but I'll use a substitute, and her name is Beth. And Beth came to me during office hours to tell me about her being medically fragile, the different types of conditions that she had, and her private insurance company was using a loophole in Massachusetts law to not provide her with what is called co-pay assistance. And I went through this whole process with her over the last 2.5 years to draft a bill to try to fix this loophole. And this is where I saw kind of the ugliness, if you will, of private insurance and their profit motives. This particular company, having gone through all the records in the exchange that Beth had experienced with this particular company, it was just very clear. The way that they were interpreting the law was intended to deny her the type of care that she needed, and they didn't care that she would be paying more out of pocket. It's counterintuitive to the thought that you have about health insurance, that it's there when you need it for the type of care that you believe that you deserve, and that the insurance companies should have your back. And I shouldn't have, as a legislature, shouldn't have to be in a position where I have to fight for my constituent against this insurance company, and then additionally file legislation to try to fix a loophole that a corporation is exploiting. So I know that issue of what our folks are paying across the Commonwealth of copays and the different bills that they might be experiencing is something that's very real in this particular district. So for me, it's really easy to come and say that I support Medicare for all in this particular conversation. And what I would just name is that, as I think about the road ahead, this particular legislation, I think, comes at a time in which we're having this conversation as city leaders, as state leaders across the country, about what are the things that we can do to protect ourselves when you have a federal partner who's advocated their role to provide for the general welfare of residents. So I'm really looking forward to the discussion today and grateful to have the opportunity to share space with all of you.
Great. Just to recap our purpose here tonight, we're going to have a conversation with each other, share our experiences, share our visions for the future, even to share doubts and questions about whether a better future is possible. That's fair. And that will also help us prepare for our forum. We hope to give everyone a chance to talk and also to be done by 7:45, so we may facilitate moving the conversation along. If you have any questions about Medicare for All in Massachusetts, we can collect them for the forum and try to get back to you after tonight. And as a reminder, we do have an interpreter, so please speak slowly and clearly, one person at a time. And when our Spanish-speaking participants are speaking, we will receive English translation back. So, to get us started, we can share our visions. What would it be like if everyone in Massachusetts could get the health care they needed without any problems getting insurance or paying for insurance? How would that feel for you? How might your life or your friends' and family's lives be different? If you'd like to share, how does the current health insurance and healthcare situation affect you? Are you sick without preventative care? What do? Are you ever stressed about getting health care or health insurance to pay for care? Can you envision a better system? Would anyone like to get us started?
I can start. So I actually, I moved to Massachusetts about 4 years ago when I had my daughter, and given that I was moving back to Massachusetts, which is where I'm from, I didn't have a job, I didn't have health insurance, didn't have anything, and I showed up here like 7 months pregnant. It's cool, good life plans. Anyway, my daughter was born and she needed surgery right away. She had a lot of complications, and the whole thing led to her living at Boston Children's Hospital for like 3 weeks, and seeing, I don't know, more doctors than I can remember or care to think about. So I felt like so relieved, actually, that I was in Massachusetts and not living where I was in Michigan, because here she qualified for Medicare. So eventually I got a check in the mail for $80,000, and that was just like from the first week that she was there. They didn't even bother to send me the bills for the other weeks. So I can really easily envision what it would look like if I knew ahead of time, hey, this is gonna be fine. Everything's gonna work out. But there's like this part of me that's like, oh, if that wasn't there, if I didn't apply for it correctly, if I didn't get it, like if I had been in Michigan, I would have gone under. I would be bankrupt, because I had a job there. So it seems counterintuitive that, like,
by not having a job, I then received more help. And there's always this like little gap where if I make more money, I receive less help. And there's a big income gap where, like right now, my daughter still qualifies for Medicare. So I don't pay for her insurance. I don't pay when she goes to the doctor. She still goes to the doctor more than your average 4-year-old, and for more things and specialists. And I don't know what I would do if I had to pay for that. That would be insane. And if I get a raise next year, I'll have to pay for it. So it's like almost like if I get a raise, I make less money, which kind of is disincentivizing, right? It's doing the opposite of what I feel like the ethos of our culture is. So it's a little bit heartbreaking. But yeah, my future would be like, hey, boss, you can give me a raise, because it means I'll get more money at the end of the day, instead of, don't give me a raise, never mind, please don't.
Thank you.
I have a similar, we were talking about like incentivization. Yeah, I started a job in 2021 that was at that time significantly paying me more. I went on to my husband's insurance as well. I was on Mass Health beforehand, but we got married and I no longer qualified for Mass Health, so we used his insurance for several years. And it felt like even though I was making more money, I have less, with everything else in context, not just health insurance, but the cost of everything going up, the uncertainty of how much I'll be paying for my student loans. With this administration, I was on the SAVE program. I have so much uncertainty, and yet I'm making the most money I've ever made, but it's not enough, because on top of having to pay more for health insurance, I still have to pay for deductibles, and it's usually blood work. I have an autoimmune disease, so I have to go in theory, every 3 months to make sure that the medication that I take, that without health insurance I'd pay $5,000 a month for, to keep me healthy. With health insurance, I don't have to pay that, thankfully, but I do have to pay for my blood work, and so I don't go as often. I go maybe every 4 to 6 months, and I'm taking a medication that could, helps me a lot, but also it can have side effects. So that's like one of the smaller sacrifices in the grand scope of what I've heard from other folks have to do. Similar, my one of my family members also has a similar autoimmune disease as I do, and he was working part-time, and he wasn't able to afford the medication then, but now that he's working full-time he can, but because of his autoimmune disease it makes it very difficult for him to work, and he's older, at retirement age, but he needs to take this medication to frankly stay alive. So it's all these factors go into, I cannot really plan my future, my family can't, because we have genetic traits that we cannot help, I didn't choose to have what I have. So yeah, it's having at least some certainty in like how I'm gonna have my health care would make it so at least the other parts of my life that we're not talking about tonight, with the expenses rising, I can plan a little bit better. Yeah.
So I'm on Medicare, and thank God for that, because if I weren't, I couldn't live in Massachusetts. We moved here from Pennsylvania 3.5 years ago. But when we were in Pennsylvania, also fighting for health care for all PA, 18 years ago, I was diagnosed with a benign brain tumor. Had to close, we didn't know it was benign until after the surgery. My dad died of brain cancer, so I wasn't sure. I had to close a therapy practice within 4 days while I was in the hospital. I was out of work for almost 6 months. Had a little bit of a disability plan that covered some of the medical expense, but not all. And I had debt from having opened a private practice of about $10,000 that I could not now pay for. And without the income that was bringing in, we had to refinance our house. Thank God we had a house to refinance. But in order to move up here, we had to wait longer than we wanted to get enough equity in our house to sell it to get a little bit of a profit from our house. So you see all the different ways that health care issues affect people. And here we are in Massachusetts now, living on Medicare. That's our income, with a little bit of money that we've got that we saved up because of COVID. And my husband worked longer than he wanted to in order to save some of his Social Security income. But 43 to 44% of our income goes toward rent. So I feel really fortunate to have Medicare, and I want everybody to have that. But even with that, it's not easy. And now here we're going to be seeing some increase in Medicare costs because our federal government is dysfunctional on pretty much every level you can imagine being dysfunctional on. So here we are in Massachusetts trying to do what's right for our citizens and also correct the craziness that's happening on a federal level. So I really want to see this, and all of these stories are very compelling. There's not a single person in this state that isn't being affected by this. Not a single person.
I can actually talk about the other side of that equation, being her husband. So it's incredibly stressful and traumatic when all of a sudden you find out your life partner has a brain tumor, has to have surgery immediately, and you don't know if it's benign. You don't know what's facing you. And we were very, very fortunate that the surgery was successful, was benign. There was no real impact on my wife's functioning. But aside from that stress, and she had what was considered really good health insurance, but we were hit with $10,000 worth of out-of-pocket expenses. As she said, she had to close her practice, she had a disability policy, but that didn't kick in until 3 months later. We still had to pay the premiums for this insurance. And the other thing is, every day we would get several different bills coming in the mail for the care that she received. And we didn't know if these bills were accurate. They had different names for different physicians and different hospitals, etc. And we had to keep track of all of that and figure out, how we were going to pay it. Was it legitimate? Would it be adjusted, etc.? And that was incredibly stressful for me, on top of supporting my wife in her recovery. And then thinking about the impact on the rest of our family, our kids, etc. If we had Medicare for all Massachusetts, there would not have been any out-of-pocket expense. There would not have been a flurry of bills, coming in the mail, adding to the stress of worrying about an ill family member and trying to support them in their recovery. So, not that it wouldn't have been stressful, not that it wouldn't have been traumatic, but there is a level of that would have been reduced dramatically if we had Medicare for all Massachusetts. The other thing is, I would have retired at 70 instead of 73. and moved up to Massachusetts sooner, which I would have liked because we have family here. So and I don't want anybody to have to go through that. I want a world that is kinder and more compassionate. And we have the resources to do it. It's not like the money's not out there. We can make a world that's more loving, kind, and compassionate for all of us.
One thing I think about a lot is the dysfunction of healthcare being tied to employment. So I've been a universal healthcare, Medicare for All advocate since long before I had lived experience, back when I was on my parents' health insurance. And then being someone that was then kicked off and someone that didn't go to college, a lot of the job opportunities that were, something that I could pursue have been being a waiter, being a bartender, Uber driver, all things that very rarely have benefits like health insurance, right? So, there were years where it felt like I could cover it. I made a lot of tips that year or that month. And then sometimes it didn't feel like a privilege that I could indulge in. I really kind of noticed the kind of ridiculousness of that dysfunction, I think, during the COVID pandemic, when, of course, restaurants were shutting down and it wasn't really safe to have hundreds of people in your car as a Uber driver every day. But, of course, without the income, then you couldn't get health insurance even if I wanted to. So that was when I think I started to really feel it, and then gratitude to Mr. Cruz for kind of speaking first about mental health, but certainly I think last year had a very similar kind of mental health deterioration journey, and had it not been for the fact that I became a city councilor, I would not have had health care, which of course was a huge relief to me, but also kind of reignited a kind of anger in a system where, the residents that I talk to every day and hear from, like, what's my advice to become a public official so you can go to the doctor? So, that I realized kind of when I was sitting over there, I had a little bit of life experience in addition to already having been sold and been an advocate.
Thank you, Kyle, for sharing your story. And it's just me and you know that.
I think that the lack of access to preventative care that affects so many people, right, for like a wide variety of reasons, whether it be that they don't have any insurance or just their co-pays and premiums are far too high, or just the anxiety, right, the anxiety of not knowing what a doctor's appointment might turn into, right? Like a lot of people avoid even their regular, like covered by insurance checkup every year because they're so anxious about what might be happening to my body and what might that mean for my future, but also my financial future, and can I afford the things that my doctor might recommend after that? And it leads so many people to not seek critical preventative care at important times in their life, and it truly shortens our lifespans. I have a lot of family members who are older who, for whatever reason, just have never had great health insurance, or maybe they own their own business and just couldn't afford to have any health insurance in other states as well as Massachusetts. And the fact that it's a thing in my family, it's like, oh boy, that uncle's turning 65 this year. He finally qualifies for Medicare, and then he can go get all the preventative care that he has been avoiding for all of these years, and hopefully will stay in our lives a much longer time as a result. So the preventative care piece of it, I think, is just so, if we had, universal health care, I think that so many people around us, it could lift that piece of the anxiety that is already, so many of these stories are just riddled with anxiety, right, about the healthcare outcomes. To have the financial anxiety too is just awful. And I'll just share one more thing. I was an RA in college for 3 years, which was a long time ago, but it's still one of the most memorable experiences because it was like the story that Manny shared as well. Just so many students that I worked with were going through such intense mental health, but also physical health crises, and just could not access the care that they needed. Either they had not enrolled in like the student insurance, or they couldn't afford it, or for whatever reason they just, there was things that they didn't want their parents to find out about. Even though they were 18, they were still on their parents' insurance, and they couldn't talk to them, so suddenly they were trying to seek free alternatives for care. And it really took an already, for many, traumatic experience of going to college and already being deeply in debt with university debt, to then just add that new level of healthcare and financial anxiety on top of it. It was just awful to watch what it did to so many students. And those are some of the memories that I have that like cannot like leave my brain. It's just those really difficult conversations as like a fellow child at the time. I'm like 20 trying to help a 19-year-old, and I'm like, I don't know how to fix this problem for you. I've got nothing. Like, this is much bigger than all of us, but I'm here with you, and I'm really sorry. So I just be great for everyone if we had universal health care.
By the way, I just wanted to recognize that my representative is here, Hannah Bowen from Beverly, and that Hannah is also one of the co-sponsors of Medicare for All Massachusetts.
Thank you.
Thank you.
Thank you, Hannah.
If I could, and thank you, Hannah, for being here. Always good to work with my colleague from Beverly. I think we have a good working relationship. I know we're not talking about the particulars of the bill, but as you posed the question to us about what would be different for our lives, I think I know it would be different for my life, but what would be different for our Commonwealth? There's been a different economic analysis that's been done on this particular proposal by faculty at UMass Amherst, and it's just very clear that in their models they've demonstrated like the state would save 30% on our healthcare costs if we were to have the bill as currently constructed. And then it's projected that for local municipalities that, again, with some respect to the CBAs that have been negotiated for healthcare, there might be an additional, several $1 billion that could be saved. So as I think about the job that Kyle and Lydia is soon to be doing, we're seeing a fiscal crisis both in our state and within our local municipalities. And knowing that our people are going to be healthier, that their healthcare is going to be more affordable, that's one component of it. But then I just think in the long term, because the bill is really about setting up this roadmap to getting to the universal coverage, the single payer system, I think it's prudent in that regard. Like, there's a lot of folks that will have questions about like, well, what's the how? Well, you're setting up an administration that's set up to answer those questions. But I would just name that the immediate benefits are that, freeing up those dollars and the savings in our healthcare system would allow us to reinvest into the things that I think we all find to be really important in our communities. So whether it's the debate that we're having now on public education, how we're investing in the other social determinants of health, like housing and employment opportunities, and I just think that is a really compelling piece for me, and I've appreciated that over the years advocates not only come with their patient stories and the things that they've experienced, which allow us to connect on a human level, but that they also come in armed with like the real research and data that talks about the benefit of what this would mean for the future of our Commonwealth.
I think too about how many people stay in jobs that they don't want to stay in because of their health care. And what does that cost the Commonwealth in innovation, in business entrepreneurship, small business entrepreneurship, because people can't take that risk to leave that job. They can't say, well, I'm going to start my own small business because I can't afford the health care. How would I do that? And I certainly can't afford to hire a couple of people to help me build this business because I can't afford to pay for their health care. And so it's a dampening effect for the entire state, for the entire country, when we don't think of healthcare as a human right, as a human necessity. And all human necessities are human rights. We have to stop treating healthcare as if it's a widget, a commodity, something that we sell, and if you have enough money you get to have it, and if you don't, oh well, too bad for you. It's just not right. The rest of the civilized world has figured this out a long time ago, and they're doing just fine, thank you. They may have some issues, but who doesn't have issues? But they're making it work, and we're not even thinking about making it work. So this is so critical for Massachusetts.
Yeah, I'm new in Massachusetts, and I come from, I'm a psychiatric nurse practitioner in the state of Oregon right now, licensed in Oregon, and I do my practice through telehealth. And Oregon is having the same conversation. They want health care for all. Oregon is a going thing. It just strikes me in listening to all these stories that there are countries in Europe that are smaller than Massachusetts that have health care for all their citizens. So one of the things that might be holding it back is the system that we have now, Medicare and Medicaid, which is paid for by people from other states. If states could somehow focus on a plan that was funded entirely by the state, and I think we'd be more likely to succeed in that venture, as long as the federal government is contributing to our plan that gives them control over what we're doing. And so why can't we take the European model and say states that have economies that are strong enough to do it, they do it on their own. And somehow we get our federal legislators to agree to that type of plan and kind of add that into our own vision of how we do it. And I see so much suffering as a result of it, of this lack of health care, and so much benefit from the little that we do offer to people who you can't afford anything else. But the suffering now is extending up the line to people who are actually in middle income, and the only people benefiting in the system are the wealthy. I was sitting in at a telehealth, a Zoom call for all the providers in our practice, and several of them are from different states now. And we were discussing the fact that one of the prominent insurance companies in the Northwest, I'll leave the name off, was asking us to lower the acuity levels that we gave to our patients so that they could pay us less. They wanted us to drop from moderate acuity level to low acuity level. And while we were having this discussion, and my boss, who is a nurse practitioner, and it's a congenial relationship in the practice, in the clinic. She was talking about it. I was looking up the salary of the CEO of that company. He was getting paid $24 million a year 2 years ago. So I'm sure he's making more now. And he was asking us to lower what we would get paid for the services we are offering. And there's already a shortage of psychiatric services because the reimbursements are low.
And static.
Yeah.
And as someone running a private practice, could you just speak to the complexity of actually taking various forms of private insurance?
Well, I joined the clinic because I couldn't manage it on my own. You have to hire a biller, and then you're at the mercy of the biller. But when you join in a clinic, you have a billing department with specialists, and for each, the way they divide it up, because of the complexity you're talking about, each insurance company has a biller assigned to them because they have to know the ins and outs of each insurance company. And we won't even take insurance from some of the companies because it's so complicated, and in the end they don't pay us. And it's been also true for the insurance companies that in Oregon operate the Medicaid plan, the expanded Medicaid plan in each county. So each county in Oregon has a different provider. There may be insurance companies doing multiple counties, but basically for Medicaid, that's how it works. And those can vary substantially in how they pay you and the amount of trouble that they give and the payments, and there's a lot of variation, so we don't want to get into that too. we need plans that really cut out these insurance companies, because even those insurance companies are in it for the money. And one of them, for instance, this year decided to pull out because they claim that they lost $5 million in our county. And that leaves us, at the mercy of other insurance companies. The county now has to renegotiate. So it's a complex system.
Thank you.
I myself spent 10 years doing medical billing for an ophthalmology practice, and it was insane how complex it is to properly submit a claim to an insurance company and make sure it's paid. For certain basic services, it's fairly simple, but you're using code books with thousands of procedure codes and thousands of diagnosis codes. And I think it's us in Australia are the only ones that use the International Classification of Diseases for the purposes of payment. Everyone else uses it for morbidity and mortality data, which was the intended purpose of this coding set. And it's this adversarial system. We're trying to get patients the care that they need and have it covered as it ought to be by their insurance company. And the insurance company is looking for every little small error or reason to not pay. It just doesn't make a lot of sense. It just doesn't. And it adds a huge administrative burden to medical practices, which is part of the cost. It's a large part of the cost of healthcare. So, anyone else?
If I could just say, we have the most expensive healthcare system in the world. We pay, I think it's 2.5 times what a lot of these countries do that have national health for their own citizens. So we're not saving anything here. Why not just get rid of the people that are using up all that money?
It's also not, this whole idea of healthcare costs going up and up, it makes it sound like the providers are making so much money and that's where it's not going there. My husband and I are retired clinical social workers, and we were in private practice for the last 27 and 25 years of our life. In that 25 years, we got an increase in reimbursement of $10 in 25 years, okay? Which meant every year we were making less money providing the same care. Where did all that money go? It went to managed care. It went to all of these leech companies that come in to manage billing and manage the billers of the billers and all of these other things that they don't provide health care. So much of the money of health care is not going to providers of health care. It's not going to doctors. It's not going to nurses. It's not going to psychotherapists. It's going to businesses that do not provide care. That's where all the money, that's where all the increase in costs is going to.
It's 30 cents on the dollar goes towards administration and profit for the insurance companies and sometimes for the hospital systems. Some of it is probably very legitimate, maybe some of it is excessive. But there is a lot of waste in the system that goes towards administration. And again, healthcare being seen as a profit center. And the commercial insurance companies, their primary responsibility is to their shareholders and to increasing the value of the stock on the stock exchange. That's their primary responsibility. It's not to patients. It's not to doctors. It's not to providers. So.
And even if you, for some reason, had some version of healthcare that you wanted to break even on, right? Let's say there wasn't a profit incentive, but you still wanted to make it even out in the wash. The problem with us having all these different plans and all these different little sections is that it doesn't work from a group risk perspective. It makes it so it's not profitable, quote unquote profitable, or at least harder to break even in certain areas of the country, certain counties within our state, certain areas of our city, right? So more rural areas that are lower income are always going to be more risky from a profit incentive to any insurer, any group that's doing insurance, which is why it's important to have as many people from as many different diverse backgrounds as possible on one big group risk profile, because it makes it more affordable for all of us, right? If we had the whole state on one big insurance pool, it would be cheaper for everyone and it would be cheaper for the people managing it, right? So even if you were just trying to break even on it to some degree, that would still be cheaper than having all these tiny little pools all over. And that's why you're seeing in lots of areas of the country and lots of counties, these private insurance companies are just pulling out. Like you mentioned, they're just leaving because it's not profitable. We can't help this community that very much needs health care because it's just not profitable to them. And yes, they're going for far too much in their profit margins, but it also, the math doesn't work because of the way we've segmented everyone. The math is just not working at all.
I think there's a problem that we don't really have here, but I'm sure that they have in other parts of the state, is that if there aren't enough people to fund a hospital, if it's not going to be profitable to run a hospital, then you can't have one there, and then they end up closing. So I lived in Hawaii for a little bit, and the geography is basically the people who have the least money are an hour away from Honolulu. There was a hospital halfway, but everybody else lives close enough to Honolulu or Pearl Harbor to be able to drive there. So we don't really need this hospital over here. And then all of the people, if you have a heart attack and you're an hour away from the nearest hospital because you are a native Hawaiian or you live really far away and you live in the not wealthiest place, then that affects every choice that you have about getting care, and it could easily cost you your life if you have something really extreme happen. So we're lucky here because we have a lot of population density and enough of a mix to have the hospitals where we need them. But I know that there are places like in Western Mass and closer to, I want to say, the Connecticut border, where it's eventually all these closures are going to pile up, and it's going to be, everybody's got to go to Boston, to get basic stuff.
Even locally, the closure of Union Hospital in Lynn. Lynn's a city of close to 100,000 people, and it doesn't have a hospital. It used to have 3. So we can see the impact within our own communities. We don't have to look even to Western Mass.
Yeah, the wait times at Salem Hospital are over 12 hours on average now because of the closure of the emergency room that was at Union Hospital.
So I don't know if this is a good time to talk about just some of the other elements of what's standing in the way to progress. But I would just name, I think the place where I think there's been a lot of momentum around the conversation, especially post-pandemic, where folks have realized that having an employer-based system is really risky. And now with the federal uncertainty, I think there is an opening for more conversation around this. We're still facing opposition, I think, from the large hospital systems, health insurers, and businesses that, quite frankly, don't see this as their responsibility. They're concerned about the fiscal elements. And so, if there's anything that I would say from, my perspective that would be helpful is we really do need that grassroots coalition. So I'm appreciative of Mass Care, Healthcare for All, our labor movement, and others who have stood behind this particular piece of legislation. But I do think we need to, also think about, who are the other voices that need to be at the table? How do we get small businesses, and when I say small, I mean micro businesses, on board with taking this on as a point of advocacy, because that is one of the things that, I recognize, for those micro businesses that may have concerns about increasing costs, they may not fully understand, just how much they would benefit from this. And I think about, 70% of our economy is like really made up of these micro businesses that are in our community that may not know that they have a role to play within not only ensuring their own employees, but also themselves. So that's one area that I certainly think we could build a lot more strength with this coalition to engage with those small business owners to talk about what's in the research that's come out of places like UMass Amherst about this particular proposal, but then also to think about the ways in which we can make room for some of the other equity based conversations that have happened around our LGBTQ plus community, Black and brown communities that have historically lacked access to healthcare, rural communities, etc. So that's one of the things that I think as we think about solutions and where places like Salem and Beverly and the North Shore can play a role in elevating different types of voices that I think we really need to hear more from on Beacon Hill.
Well, that's a good segue into something that I can pass along to our representatives who are here. Business and Medicare for All. This is a new publication from Mass Care, and we didn't even plan that, did we?
No, not at all.
And so I'll pass this along as we end. Is this the time for me to talk about the petition, or did you want to?
Does anyone have any final thoughts? We are getting close to time. But does anyone have anything they want to say before we wrap up? All right,
I have one thing. I think that the system that we have is collapsing faster than we know from what I'm seeing. And I think the urgency, I think people have to realize the urgency. We need to have people talking more about hospital closures everywhere. I know in the Midwest, people are now having to travel 400 miles or 300 or 400 miles just to have a baby in a hospital. And that's increasing, not decreasing. And it's increasing all over the country in lots of different ways. We talked about the pay scales of the practitioners. I heard there's some fantastic figure out there that we'll have an 80,000 will be lacking 80,000 doctors' positions next year. That's what they figure is that, and doctors are leaving and not going into medical school. People are not going into medical school because it's not paying what it used to pay. And nurse practitioners are taking over because their education doesn't cost as much, but even they are not getting paid enough to live on what they earn.
Yeah, I appreciate you raising that. I think we should just name we're having this conversation in the context of what's happening in Washington with the healthcare subsidies and the fact that, I think in large part because of the administration, but then also the Democrats who capitulated, regardless of when we get to the conversation about a vote on that matter, the subsidies are going to go away. So if there was anything that I would leave on a last note is that bills like this are about a vision of protecting the Commonwealth and our values in the event that we have a federal partner who's just completely unreliable. So, I do think that this is one of the ways in which, as we think about the future of the Commonwealth, how we want to pass on a better Commonwealth to our children, to our future descendants, this is the way that we can do that in the face of federal uncertainty, devastation that's coming down the pike, and I think an affordability crisis that is bad enough is going to get exacerbated. So I'm really hopeful that in this particular session that we can continue to make the type of push to link those two efforts together, because this is where the gap lies, is what role can states play. We know what the field is probably going to look like after December, so this is the time to, I think, make a real big push on Massachusetts' response, and the hope being that Massachusetts, being a state of firsts, could inspire other states to do the same, so that we can really continue to grow the movement and the progress, and then hopefully we can elect different types of leaders in Washington that believe that this is actually the solution to the healthcare crisis.
And that's what happened in Canada. Saskatchewan was the first province, and then it gradually rolled out to the rest of Canada. And the person who led that fight was Tommy Douglas, happened to be a socialist, also a minister, and he was recently, he's passed on many years ago, but he was recently voted the most popular Canadian ever, Tommy Douglas. Not Wayne Gretzky, but Tommy Douglas. And,
Never play Trivial Pursuit with this guy.
so, as you're leaving, if you're interested, there's a petition that Mass Care is hoping to deliver to the Joint Committee on Healthcare Finance to finally get it voted, legislation voted out and voted favorably, so it gets to the floor. This is simply to indicate your support for that. We're going to present it at the State House sometime in January. We have 1,399 signatures. We're going for 2,000. So if you can sign this on your way out, that would help us. Thank you. Oh, and I have a few pieces of bling if anyone's interested.
Thank you so much. And thank all of you for being here and sharing your stories and your thoughts. This was a great conversation. Really appreciate it. And thank you, Representative Cruz, for being here as well. All right. Have a great night, everyone.
Thank you, Katie.
Thank you.
Thank you, ma'am.